Bismillahirrahmanirrahim. Assalamu alaikum. Guys, today I'm going to deliver the session on sexual assault. This is very important topic for exam, especially for the clinical exam, and this is also very important for the GPs and the medical legal officers who are performing work in the medical legal department. So sexual assault is very common. It's 1 in 5 women aged 16 to 59 years having experienced sexual violence. It covers offenses from indecent exposure to rape. The WHO defines the sexual violence as a sexual act, attempt to obtain a sexual act, unwanted sexual comments or advances, or acts to traffic or otherwise directed against a person's sexuality using coercion by any person, regardless of their relationship to the victim in any setting, including but not limited to home and work. Many women complaining of sexual assault will have few or no injuries. Only 1/4 of the women who present following sexual assault having genital injuries. So remember 1/4 of the women having a genital injuries. Minor injuries, they do not require suturing. They should not be cleaned initially because sample can be taken from these sites for DNA evidence. So remember the minor injuries, they do not require suturing, they do not clean. Each injury should be described in the clinical notes that include the shape, depth, color, and tenderness. If possible, use a body diagram and a tape measures to measure the size of the injury and its distance from fixed anatomical landmark. For example, the injury is 1 into 3 centimeter, pupil, bruise 5 centimeter above the left knee joint. So this is the anatomical landmark. The knee joint is the anatomical landmark. So you note the size, shape, color, and the landmark, right? It's possible to photograph the injuries, but written consent will be necessary for this. At a forensic medical examination, a digital camera can be used and genital injuries can be photo documented using a colposcope. Taking early evidence, the woman should be advised not to wash or wipe herself if she is considering a forensic medical examination. She should also not eat, drink, or pass urine prior to early evidence being collected. So, any woman who wish to have a forensic examination, they should be advised not to wash, wipe, eat, drink, or pass urine prior to early evidence being collected. An early evidence kit should be used to collect evidence, and this is available in the emergency department. The contents of this emergency kit vary, but the minimum requirement is urine collection and a mouth rinse. Look here in this examination. See here, this is the anatomical examination points. We see the location, shape, color, type, size, and pain, right? So this is the injury recorded and this is the early evidence kit. So ask the woman, do not wash, wipe, eat or drink or pass urine. Collect contact with the police or sexual assault referral centers, that's called the SOC, to discuss the early evidence kit. That early evidence kit is available in the emergency department, right? It contains a urine collection pot and mouth rinse. Collect vital evidence if oral penetration is reported. Mouth swab. Urine collection pot increase the chance of detecting the drugs, alcohol used to facilitate the assault. Right? So this is the early evidence kit. After the sexual assault has been performed, there are few problems. There is risk of pregnancy, 5% risk of the pregnancy after vaginal rape. So here it's very necessary to prevent the pregnancy. Women should be offered all methods of emergency contraception, including the copper intrauterine devices. The copper IUCD is most effective form of emergency contraception and is inserted within 5 days after the first unprotected sexual intercourse in a cycle, or within 5 days of the earliest estimated date of ovulation, whichever is later. Ulipristal acetate emergency contraception has been demonstrated to be more effective than levonorgestrel emergency contraception up to 120 hours after unprotected sexual intercourse. So, this is the pregnancy prevention. Now, coming to the immediate care and follow up. Immediate care, who is the vulnerable group, ongoing follow up, and management of the STIs. In the management of the STIs, first we do the screening for sexually transmitted infection. Most screening for sexually transmitted infection should be done 2 to 3 weeks after the assault because of the incubation time of the pathogens. The prophylaxis against bacterial sexually transmitted infection is rarely offered but can be considered in those whose risk of infection is high and who are unlikely to attend for the follow-up. Blood test at 3 months should be offered to screen for hepatitis B, syphilis and HIV. So screening immediately at 2 to 3 weeks and then at 3 months. HIV post-exposure prophylaxis should be discussed with every woman. Unprotected anal intercourse carries the highest risk. It's likely that the strength of the recommendation and subsequent uptick will be higher when the assailant is perceived to be from a high prevalence group, such as a man from sub-Saharan Africa, a man who has sex with men, or a man who is an IV drug abuser, or post-exposure prophylaxis should be started as soon as possible, but within 72 hours and continue for 4 weeks. So, HIV post exposure prophylaxis should be given in a high risk group. Start it as soon as possible, but within 72 hours and continue for at least 4 weeks. An accelerated course of hepatitis B vaccine should be offered at 0, 1, 3 weeks or 0, 1, 2 months with a booster at 12 months in either course. Assess the GLIC competence. If the girl is 16 years of age or below 18 if they have learning difficulties. So in these cases you have to assess the GLIC competence. Staff involved in the care of these women should assess the risk of domestic violence. This may be done by using the domestic abuse, stalking and honor-based violence risk checklist. This is called the DASH risk checklist. And in turn, considering a multi-agency risk assessment conference referral. Forensic evidence. The SOC model has been promoted by the Home Office as the gold standard of the care for victims of sexual assault. The SOC may offer a forensic medical examination with collection of DNA and other evidences without the police being involved, giving the woman the opportunity to consider her options and report the assault at a later date. Forensic specimens should only be collected if the clinician has specialist training in this area. Therefore, it is not within the remit of the gynecologist on call. In general, the swab can be taken up to 7 days after vaginal penetration, 3 days after anal penetration, and 2 days after oral penetration. A toxicology screening will be sent from blood within 3 days of the assault and from urine within 14 days of the assault if a drug facilitated sexual assault is suspected. Follow-up of such women. All women should be offered follow-up care arranged in a genitourinary medicine clinic with their GP or possibly at a local SOC. The follow up appointment should be arranged before the starter pack of Pepsi medication finishes, usually 3 to 5 days, followed by weekly if problem or 2 weekly if no problem. Follow up appointment until completion of the course of medication. Women should be offered hepatitis B screening and vaccination within 6 weeks of the start. Screening for sexually transmitted infection generally occur 2 weeks after the assault. Serological tests for hepatitis B, C, HIV, and syphilis should be offered 3 months after the assault or 4 months if the woman has had used the Pepsi. The pregnancy testing may also be necessary. Rape victims are more likely to develop the post traumatic stress disorder than victims of any other crimes. So remember, these women need the psychological assessment. The symptoms of the post traumatic stress disorder, including re experiencing the incident in the form of flashbacks or nightmares, avoidance of reminders of the assault. So, avoid the reminders of the assault. Hyperarousal with effects including difficulty in concentrating, irritability, sleep problems. So, emotional numbing, meaning a lack of ability to experience feeling. So, this all sexual assault is taken from the TOG article and infographic. Thank you, guys. Thank you.